What is the difference between macro and micro resource allocation? Imagine you're organizing a big community event. You decide how much money to spend on food, entertainment, and decorations. Now, think about how those choices are made at different levels. That's what we call resource allocation in healthcare. In healthcare, macro resource allocation is like planning the entire city's health budget. It involves big decisions about how much money the government or society spends on health. For example, setting a budget for hospitals, deciding how much to invest in disease prevention versus treatment, or choosing which health issues get priority across the country. These decisions are based on public policies, societal values, and ethical ideas like fairness and justice. They often involve trade-offs, like whether to spend more on cancer research or infectious disease control. These choices influence the overall health of populations and are shaped by economic constraints and political priorities. Micro-resource allocation is more about individual choices. It's like deciding which patient gets a life-saving treatment when resources are limited. For example, during a pandemic, deciding who gets a ventilator or who is on a transplant waiting list. These decisions are made by healthcare providers based on clinical judgment, patient needs, and fairness. They focus on fairness, urgency, and medical benefit. Ethical challenges here include avoiding bias based on age or social status, and making sure decisions are transparent and justifiable. Both levels of resource allocation are guided by core ethical principles, especially justice. Justice means distributing healthcare fairly without discrimination and prioritizing the greatest good for the most people while respecting individual rights. At the macro level, justice involves fair policies that benefit society as a whole. At the micro level, it's about fair treatment of individual patients. For example, a government might decide to increase funding for mental health services. That's a macro decision. Then, individual clinics must decide how to distribute those resources among patients with different needs. Ethical principles help ensure that both levels align with societal values and fairness. In essence, macro resource allocation sets the rules for how resources are shared across society. Micro resource allocation decides how those resources are used for each person. Both are essential to creating a healthcare system that is fair, effective, and just. They work together to make sure everyone gets the care they need, when they need it, and in a way that respects everyone's rights.